Bismillahirrahmanirrahim. Today we will discuss physiological anatomy of the parasympathetic nervous system, and this is a second lecture regarding autonomic nervous system. This is second part or second lecture. The parasympathetic nervous system use cranial nerves and sacral nerves fibers. So the cranial nerves are 3rd nerve, 7th nerve and 9 and 10, and the sacral nerve are 1st and 4th are 2nd and 4th nerve. They are originated from the sacral region, and the cranial nerve directly originated from the brain. The 3rd nerve is the oculomotor nerve. The 7th nerve is the facial nerve. The 9th nerve is the glossopharyngeal nerve, and the 10th nerve is the vagus nerve. The parasympathetic fiber leave the central nervous system through cranial nerves 3, 7, 9 and 10. Additional sympathetic fiber leave the lowermost part of the spinal cord through the 2nd and 3rd sacral spinal nerve, and occasionally the 1st and 4th sacral nerve. About 75% of all parasympathetic nerve fiber are in the vagus nerve, which is cranial nerve 10, passing to the entire thoracic and abdominal region of the body. So this cranial nerve, the 10th cranial nerve or the vagus nerve, supply the structure in the thorax and abdomen. Therefore, a physiologist speaking of the parasympathetic nervous system often think mainly of 2 vagus nerves, because the vagus nerve is the major supplier of the parasympathetic nervous system. They supply major organ of the body. The vagus nerve supply parasympathetic fiber to the heart, lung, esophagus, stomach, entire small intestine, proximal half of the colon, liver, gallbladder, pancreas, kidney, and upper portion of the ureter. You can see there the parasympathetic cranial, the vagus supply organ in the thorax and the whole gastrointestinal tract. Parasympathetic innervation to the descending colon and rectum is provided by the pelvic nerve, which exits from the spinal cord at segments S2 and S4. This is S2 and S4. So this is the descending portion of the colon, which is supplied by the sacral nerve 2 or 4. The somatic pudendal nerve also originates from the segment S2, S4, innervate the external anal sphincter and pelvic floor musculature. So here the pudendal nerve also arises from the S2 and S4, and it supplies the external anal sphincter and the floor of the muscles. Between stressful situations, the body needs to rest, recover and gain new energy. So stress, rest and stress. So between the stressful conditions, stress and between the stress, there is a condition which is called the restful condition, and during this rest the body regains its energy again, and this time is used for the maintenance of the organs. These tasks are under the control of parasympathetic system. The rest timing of the body is under control of the parasympathetic nervous system, which lower the heart rate and blood pressure. During rest, the heart rate is become lower down or come to the normal rate, and the blood pressure is also become normalized, and divert blood back to the skin and the gastrointestinal tract. As in sympathetic activity, the blood is diverted to the active organs, the heart and the skeletal muscle, but when the body is in rest, the blood is again diverted to the skin and the gastrointestinal tract, because during rest the person take food, or if any food in the gastrointestinal remain, so digestion of that food is again restarted, and the blood is diverted from the muscle and heart towards the gastrointestinal tract and skin. Contract the pupil and bronchioles. So in sympathetic activity, bronchioles are dilated, the pupil is dilated. So in parasympathetic activity, the pupil contract and the also the bronchioles are contracted. Stimulate salivary gland secretion and accelerate peristalsis. So the digestive system is started, and it in restful condition, the salivation and gastric secretion and peristaltic movements are re-established or encouraged. The parasympathetic system influences organs towards restoration and the saving of energy. So when digestion, food is absorbed and energy is obtained or restored from the food. So difference between the sympathetic and parasympathetic system. Sympathetic system involved in the fight or flight response. Parasympathetic is involved in maintaining homeostasis and also promote the rest and digestive response. The sympathetic system prepares the body for an potential danger, fight or flight mode. The parasympathetic system aims to bring the body to a state of calm. In this parasympathetic system, the body is become calm and all the systems are become normalized. Sympathetic system has a shorter neuron pathway, hence a faster response time. The neuron of the sympathetic nervous systems are short, so the response is quick and faster. While the parasympathetic have long neuronal pathway, so the action begins slowly or take time, more time than the sympathetic nervous system. Sympathetic nervous system increase heartbeat and make the muscle tense, while the parasympathetic nervous system reduce heartbeat and muscle and cause relaxation of the muscle. Here the pupils are dilated to let in more light. The pupil is contracted. It causes the salivation inhibition, and here saliva secretion increase and digestion increase. In fight and flight situation, adrenaline is released by the adrenal glands, and more glycogen is converted to glucose. Glycogen is stored in the muscle and liver, and in the flight and fight move, more energy is required, so glycogen is converted to glucose for energy. While in parasympathetic activity, the conversion of glycogen doesn't occur, or it has no role in the conversion of glycogen to glucose. Parasympathetic and preganglionic and postganglionic parasympathetic neurons. The parasympathetic system, like the sympathetic, has both preganglionic and postganglionic neuron. Parasympathetic nerve, the preganglionic fiber, pass uninterrupted all the way to the organ that is to be controlled. In the wall of the organ are located the postganglionic nerves. The preganglionic fiber synapses these, and very short postganglionic fiber, a fraction of millimeter or several centimeters in length, leave the nerves to innervate the tissue of the organ. Here you can see this is the sympathetic side of the nervous system, and this is the parasympathetic. Here you can see we have preganglionic neuron and postganglionic neuron, both in the sympathetic and parasympathetic system. But in sympathetic system, the postganglionic neuron are long, except in case of renal gland. While in the parasympathetic nervous system, the preganglionic neuron are long, and they just terminate on the surface of the organ, where postganglionic neurons are present. These neurons are very short. You can see that the sympathetic neuron originate from the brain or spinal cord, and they actually terminate in the organ where postganglionic, very short postganglionic neurons are present. And this occurs in all organs which are supplied by the parasympathetic nervous system. Here you can see a more clear picture that these are the preganglionic neuron of the sympathetic nervous system, which arise from the brain or from the sacral region, from the cranial nerve, either the cranial nerve or from the spinal sacral nerve. You can see that the preganglionic neurons are very long, and here they synapse with the postganglionic neuron, which are from few centimeter or millimeter to few centimeter long. So the difference between sympathetic and parasympathetic nervous system on the neuronal basis is that the preganglionic neuron of the parasympathetic nervous systems are long, and the postganglionic neuron of the sympathetic nervous system are long. Function of parasympathetic nervous system. As easy economy to remember how and where the parasympathetic nervous system is slurred. This stands for the slurred, or SLUDD stand for S for salivation. As part of its rest and digestive function, the parasympathetics stimulate production of saliva, which contain enzyme to help food digestion. So S is for salivation, L is for lacrimation, and it makes tears. Tears keep eye lubricated, prevent their delicate tissue from damage. And urination, the parasympathetic nervous system contract the bladder, which squeeze it so urine can come out. And digestion, the D is for digestion. The parasympathetic nervous system stimulates the release of saliva to promote digestion. It also acts or increase peristalsis, or the movement of stomach and intestine to digest food, as well as release bile for the blood to digest fats, for the body to digest fats. And defecation, the parasympathetic nervous system constrict the sphincter in the intestine and move digestive food material down the digestive tract so person can have a bowel movement. Also, venous supply the nerve and blood vessel responsible for male erection. So, sympathetic system is also participate in sexual activity. Parasympathetic fiber in the third cranial nerve go to the pupillary sphincter and ciliary muscle of the eye. Here you can see that this is the pupil, this is, you know that the sclera, we have a cornea. In the cornea we have a dark area. The dark area is called the iris, and in the iris we have a hole. This hole is called pupil. So the parasympathetic nervous system is responsible for the dilatation of pupil. Here you can see this is a contracted pupil, and here you can see this is a dilated pupil. So the muscles of the eye are supplied by the parasympathetic nerve fiber, which cause dilatation of the pupil. The facial nerve, actually fiber from the seventh cranial nerve, pass to the lacrimal, nasal and submandibular gland. Here you can see this is the facial nerve, and here the fiber are passed to the lacrimal glands, to the nasal gland and to the submandibular gland. So they got production of tears, production of nasal discharge and production of saliva. The ninth cranial nerve and its fiber from the ninth clear nerve go to the parotid gland. This is in the parotid, which is a mixed gland which secretes mucus and saliva, and the ninth cranial supply the parotid gland. It also causes salivation. Bowel management, or the management of the gastrointestinal tract. Parasympathetic innervation to the portion of the bowel extend from the esophagus to the splenic flexure of the colon, which modulates peristalsis, is provided by the vagus nerve. You can see that this is the vagus nerve, and it supplies the gastrointestinal tract from the esophagus to the flexure, the splenic flexure of the large intestine. So the esophagus, stomach, the whole small intestine, the ascending colon and the transverse colon up to the level of splenic flexure is supplied by the vagus nerve. Parasympathetic innervation to the descending colon and rectum is provided by the pelvic nerve, which is exact from the spinal cord at a segment S2 and S4. You can see this area, the descending colon and the rectum, it is supplied by the S2 and S4. The somatic pudendal nerve also originates from the segment S2, S4, innervate the external anal sphincter and pelvic floor muscle. So the external anal sphincter is supplied by the pudendal nerve, and floor of the pelvic muscle are also supplied by the pudendal nerve. This is a more clear picture. You can see that the esophagus, stomach, the ascending colon and transverse colon up to the level of splenic flexure. This is hepatic flexure and this is splenic flexure. This area from esophagus to here, the splenic flexure of the gastrointestinal system is supplied by the vagus nerve, and here this is supplied by the sacral parasympathetic division S2 and S4. Neural control of the airway smooth muscles or the respiratory system. The preganglionic fiber of the parasympathetic nerve are localized in the brain stem, dorsal vagal nucleus and nucleus ambiguous. This is the dorsal vagus nucleus and this is the nucleus ambiguous, and they both supply the respiratory system. Upon reaching the airway, the preganglionic fiber form synapse and at the parasympathetic ganglion located in the trachea and bronchi plexus in the airway. Here they make a synapse with the postganglionic neuron, which are actually located in the bronchial plexus. The ganglion neuron play an important role in integrate, filtrate and modulate the various input signal and regulate the electrical activity carried by the postganglionic efferent fiber to the airway smooth muscles. So the preganglionic in the originate from here the brain, from the brain stem, and it supply the lungs and bronchi or the airway muscles. Parasympathetic supply of the heart. The parasympathetic portion of the cardiac plexus receive contribution from the vagus nerve only. The preganglion fiber branch from the right and left vagus nerve reach the heart. Here you can see this is the vagus nerve, the right, and here the left is, this is the right and the left vagus nerve. They arise and reach the heart. They enter the cardiac plexus by synapsing with the ganglia within in the plexus and wall of the atria. Here are the cardiac plexus, and they make synapses here and then enter the atria. Parasympathetic innervation is responsible for reduce the heart rate, reduce the force of contraction of the heart, and vasocontraction, narrowing of the coronary arteries. So cardiac plexus are actually formed. They are formed by the branches of the vagus nerve and sympathetic trunk that supply the thorax, viscera, and blood vessel. The cardiac plexus may be considered as comprising interconnected aortic arch, right and left coronary, and right and left atrial plexus, all lying in the adventitia of the under epicardium. M2 receptor. There are a number of special receptors for the parasympathetic nervous system in the heart called Muscarinic receptor, which Muscarinic receptor are many types. So M2 receptor is present in the heart, and they are called Muscarinic receptor. Parasympathetic stimulation of M2 muscarinic receptor cause decreased heart rate and velocity of conduction through the AV node, inhibiting sympathetic nervous system action. So these M2 receptor actually act on the AV node and slow down the heart rate by inhibiting the sympathetic activity. These are the M2 receptors here which are present in the heart. Muscarinic and nicotinic receptor. Now here we discuss that muscarinic receptor is present in the heart, so you must know about the muscarinic and nicotinic receptor. Muscarine is actually a poison from toadstool and activate only muscarinic receptor, and where nicotinic activity is initiated by nicotinic receptor. The nicotinic activity is activated by nicotinic receptor. But one thing is acetylcholine activate both of them. So here remember one thing, that when acetylcholine is released, it activates both nicotinic receptor and muscarinic receptor. But how we can differentiate between the muscarinic and nicotinic receptor? This is the nicotinic receptor and this is the muscarinic receptor. So when muscarine is present, so only muscarinic receptor is activated and nicotinic receptor don't show any activity. And when only nicotine is available, muscarinic receptors are silent. So on this way we can differentiate between the muscarinic and nicotinic receptor. But when acetylcholine is present, it activates both the muscarinic and nicotinic receptor. But the action of these two receptors are different. Muscarinic receptors are found in effector cells that are stimulated by the postganglionic cholinergic nodes of either the parasympathetic nervous system or the sympathetic nervous system. So muscarinic receptors are activated both by the sympathetic and parasympathetic nervous system. Nicotinic receptors are found in autonomic ganglia at synapse between the ganglionic and preganglionic and postganglionic neuron of both the sympathetic and parasympathetic system, and understanding of the two types of receptor is especially important because specific drugs are frequently used as medicine to stimulate or block one or the other of the two types of receptor. So we use drugs. In some cases we need blockage of the muscarinic receptor, and in some cases we need blockage of the nicotinic receptor. So the understanding of these receptors is important. The parasympathetic nerve stimulate system use only acetylcholine as its neurotransmitter. Parasympathetic system use only acetylcholine on preganglionic neuron at the level of preganglionic and also on the postganglionic level. The parasympathetic nervous system utilize or use acetylcholine. The acetylcholine act on two types of receptors, the muscarinic and nicotinic cholinergic receptors. We know that any receptor which responds to the acetylcholine is called cholinergic receptor. Most transmission occur in two stages. When stimulated, the preganglionic neuron release acetylcholine at the ganglia which act on nicotinic receptor of the postganglionic neuron. The postganglionic neuron then releases acetylcholine to stimulate the muscarinic receptor of the target organ. Main difference between nicotine versus muscarinic receptor. Nicotinic and muscarinic receptor are the two main types of cholinergic receptor. They are integral membrane protein activated by the binding of acetylcholine, a neurotransmitter. Through the same neurotransmitter bind to both types of receptor, the mechanism of action is different in each receptor. Here muscarinic receptor is activated by acetylcholine and nicotinic is also activated by but the activation mechanism is different. The main difference between the muscarinic receptor is that nicotinic receptor become ion channel for sodium upon binding of acetylcholine to the receptor, where muscarinic receptor phosphorylate various second messenger system. The nicotinic receptor actually bind to the ionic channel. They are transmembrane, both are transmembrane channels, and the nicotinic receptor actually activate the ionic channel, the sodium potassium, and here the muscarinic channel actually activate the second messenger system. Nicotinic receptors are also called inotropic acetylcholine receptor, while muscarinic receptors are also called metabotropic receptors, acetylcholine receptor, depending on their action. Thank you. Please subscribe the channel and press the bell icon for in-time notification and leave your valuable comment for improvement of the channel. We will discuss these mechanisms in detail in the upcoming lecture. Because the lecture is getting prolonged, so at this moment I am ending the lecture, and I will elaborate the further mechanisms and the actions of these receptors in the next lecture. Thank you once again.